It is 9 o'clock here on Tuesday, July 11th. We'll call the Wright County Board of Commissioners to order. We'll begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everyone. We have somewhat of a lighter agenda today, but we'll go right at it. We're starting off with the minutes from the county board meeting of June 20th. Is there any corrections or modifications? Otherwise, I'll entertain a motion to approve those minutes.
I'll go ahead and make that motion.
Second.
All right, we have a motion by Commissioner Shane, second by Commissioner Dietrich. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Minutes are approved. Now we have the approval of the minutes from the June 21st Personnel Committee.
Any questions? I'll go ahead and make that motion.
I will second that.
All right, we have a motion by Commissioner Shane, second by Commissioner Dietrich from the Personnel Committee minutes. Any discussion? Hearing none. All in favor say aye.
Aye.
Opposed, same sign. All right, today's agenda, is there anything that needs to be added to today's agenda? Otherwise, I'll look for a motion.
Sir.
I'll make the motion to approve the agenda.
All right, motion by Commissioner Dietrich,
Second.
second by Commissioner Shane. Any discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Today's agenda is approved unanimously. Now moving on to the consent agenda. Does anyone like to remove anything from today's consent agenda for further discussion? Otherwise, I'll entertain a motion.
I'll make that motion.
Motion by Commissioner Shane,
Second.
second by Commissioner Dietrich. Any discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Consent agenda approved unanimously. We're running really close to on time. County Attorney Brian Lutz, you have someone to introduce to us.
Yes, good morning,
Morning.
Chairman Vetch and Commissioner Dietrich, Commissioner Shane. It's my pleasure to officially welcome Lee Marty to the board as my Assistant Civil Division Chief. It was my pleasure to have the opportunity to bring Lee back to Wright County. Lee has lived in Monticello as I have for a long time, so I've known Lee through the community for a long time. Lee was previously with our office from 2002 to 2010. I started in 2000, so I worked with Lee for those 8 years. Kind of a funny story, I became Criminal Division Chief in 2010, October of 2010, and I had our first big meeting. We're not big on meetings, we still aren't, but I had a big meeting with the whole group and the staff, and I announced that I was going to split the crim sex caseload, one of the most serious caseloads in our office. Mark Erickson had it entirely forever, and so I brought Lee on, and Lee was going to share one half of the criminal sexual conduct cases. So we got back upstairs in the old building to our office, and Lee pulled myself and Tom Kelly and our office manager, Cindy Hole, at the time, into a room and said, "Hey, look, I'm leaving." So I think I drove Lee away by that meeting. But just kidding. He had some things going on, and he tried private practice for a bit. After that, he went and he worked in Meeker County, where he did lots of different case types. And then for the preceding 5 years, he was with the Anoka County Attorney's Office doing CHIPS cases. And I knew from the position vacated by now Judge Bowen that where we have a weakness in our office is supervision of CHIPS cases. So I reached out to Lee, let him know of the position. He applied and was our top candidate, and the rest is history. So I'm hopeful that Lee can finish his career in Wright County, and I was very happy that I had the opportunity to bring him back, and I hope you'll join me in welcoming him to Wright County. So with that, I'll turn it over to Lee for a few words.
Excuse me. Thank you. I am very excited to be back in Wright County, and I'm glad to bring some diversity back to Wright County. I could say that Wright County could use some more short people. So I'm glad to bring that diversity back. So with that, thank you. Like I said, I'm glad to be back.
Now, Lee, we're very fortunate to have you back here at Wright County. Look forward to working with you. I'm sure Greg will be tasking a variety of other items to get to, hopefully us as board members get to work with you on, I'm sure.
Sounds great. Thank you.
And I believe the appointment is in the file, so I just need that to be approved. So thank you.
All right, so looking for a motion to get the approval of the appointment for the oath for Lee Marty as the Assistant Civil Chief.
I'll go ahead and make that motion, Chair.
All right, we have a motion by Commissioner Shane,
Second.
second by Commissioner Dietrich. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Motion passes unanimously. Welcome aboard, Mr. Marty.
Congratulations. Welcome.
Thank you very much.
And you're going to ask him for a window office, right?
I saved Bowen's office.
You say, there you go. All right, moving on to the 907. We're darn close on it. Jacob Wegeman has a resolution authorizing the signatures on the amendment to SRF 0338. The 1-year extension to the septic low-interest loan program.
Yes. So, yep, just in front of you here today, to get approval to DocuSign a document that states to continue the septic loan program till July 22nd, 2024. If not, our current loan will expire in 11 days. So,
On that program, we have just a handful of people, I think, that are utilizing it.
correct. We average about six people a year utilizing it for the tune of $26,000 on average. So,
Well, we got it over a handful. It used to be only a handful, so that's it's
sure.
better interest rates than you can get on the market right now with the way interest rates are at. I think
Correct.
that was more of a factor before. Interest rates are so low that people didn't necessarily need to utilize it, but now with the way interest rates are at, it's becoming more. You probably will see more potentially in the next year.
I think so. So, yeah, it's a 3% loan for 10 years, assessed on the property tax value. So,
Can't find that anywhere.
I don't think so.
So I'll entertain a motion for that.
I'll make that motion.
Motion by Commissioner Dietrich,
Second.
second by Commissioner Shane. Any discussion? Hearing none. Resolution vote. Commissioner Shane?
Aye.
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 Resolution passes unanimously.
Thank you so much.
Thank you. We're moving quite fast here, but I think it's close. I don't know that I want to go into, I think we'll just really quickly, because I want to keep us somewhat not going too far ahead. We'll go to the items for consideration, the discussion of cancellation of the July 18th board workshop. So with the lack of items to need to address at this time and taking into consideration the conflicts with a couple members, myself and Commissioner Holland would not be in attendance. We're looking to cancel the July board workshop for next Tuesday. But that was a discussion, but if that's the case, we'll just entertain a motion to do so.
I'll make that motion to cancel the July 18th board workshop.
All right, motion by Commissioner Shane,
Second.
second by Commissioner Dietrich. Any discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Board workshop is canceled unanimously. All right, I think we're close enough now that we can go back to the Health and Human Services meeting. We're just 2 minutes out. We'll call Jamie up here. Starting off, the first one would be the Health and Human Services consent agenda. We have 3 items on there. Looking to get a motion for that, or unless anybody would like to pull any of them for further discussion.
I'll make that motion.
All right, motion by Commissioner Dietrich,
Second.
second by Commissioner Shane. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Consent agenda approved unanimously. All right. So now we come on to the Health and Human Services agenda. We have the first one to adopt a resolution HHS 2301 for June donation acceptance. I'll entertain a motion for that.
I'll make that motion.
All right. Motion by Commissioner Shane,
Second.
second by Commissioner Dietrich. Any further discussion? Hearing none. It's a resolution. Commissioner Shane?
Aye.
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 Resolution passes unanimously.
Fantastic, thank you.
And now we get to kick it back to you, Jamie, to do a introduction and recognizing the HHS Employee of the Month for July.
Thank you. Yes, I'm happy to do this, and I will ask for Ellie Vanas to join me at the podium. Ellie, Eleanor, as you can see, is our July 2023 HHS Employee of the Month. She is a public health nurse in the Health Promotion and Protection Team. She joined Wright County in August of 2016. In her role as a public health nurse, she implements strategies to reduce opioid misuse and coordinates an internal work group that addresses health equity in public health policies and programs. Ellie serves as a chief strategist for the Opioid Settlement Advisory Council, and you'll be hearing from her later on that score. Her nominator states, Ellie is very knowledgeable and is always willing to assist coworkers as well as go the extra mile for clients. She is a leader in health equity and is very conscious of equity in everyday life. She helped develop health equity squads for staff to be able to learn and grow with their coworkers. Ellie and another coworker were chosen for a National Health Equity Awakened cohort. They've implemented various activities from it and taught their coworkers about what they learned during this year-long cohort. Ellie is very eloquent in her writing and is frequently called upon to help with grant writing and other projects. She is on multiple teams in public health, including Statewide Health Improvement Partnership, which is SHIP, the WOW program, 60 Plus and Healthy Clinics, Media Work Group, and the Substance Use Prevention, Treatment, and Recovery Team. All of the teams and programs that she works on are greatly enhanced by her leadership, creativity, and dedication. Thank you, Ellie, and congratulations for being our 2023 HHS July Employee of the Month. And before we recognize her, I wanted to also point out that Ellie was named in the Minnesota Health Equity Network's newsletter, and Wright County was held up as a model for the Health Equity Learning Squad, so getting some statewide recognition in that area as well. So congratulations, Ellie. Would
Thank
you like
you.
to say anything?
Congratulations.
Thank you. I think all I want to say is that I'm really grateful for the great coworkers that I have in public health and that they have helped me maintain sanity over the last 5 years of chaos that has been our role, and that none of this work would exist without the rest of them as well. So
There you go. Thank
Thank
you.
you.
For your great work and
Congratulations. Thank
dedication to the county.
thank you.
Director's comments.
Yeah, I didn't think I was going to have too much, and then I sat down yesterday, and there are a couple. So, first of all, Wright County, I just mentioned, was a model in the Health Equities newsletter. We also were called out in the Opioid for Community Advocates on the opioid settlement in Minnesota. And if you see this little, I don't know if it's in your packet or not, the little sidebar, it says local planning example, Wright County established an advisory council to advise the Board of Commissioners on the best way to spend funds. The council sought public input to determine its funding priorities in Wright County Public Health. The county's chief strategist created a guide for local organizations and sectors adjacent to overdose to help them understand how funds may be used to support their grant application efforts. So just for your awareness that this was part of a Minnesota publication under Vital Strategies. Also, just an awareness, the well water testing lab has been moved from the planning and zoning area to one of our exam rooms up on second floor in Health and Human Services. Everything is running well. Right now, we're doing private well testing. We won't start the regulatory testing till we get our accreditation, which I'm not sure. John, do you know when we're expecting that? So we're working on the accreditation piece for the rest of it. So if you want to take a look at that, that is upstairs in our second exam room. You should have in your packet our DHS performance report on cash assistance and SNAP timeliness measures. The reporting date is actually all of 2022, but we just got, it was, I think it was published in April and we got it in June. So we received it last month. Unfortunately, the first measure, which is the percent of SNAP and cash assistance applications processed timely, was missed by 1/10 of 1 percentage point. 75 is the threshold. We were at 74.9. We did talk with the state to see if they couldn't just let us get over this tiny little hump, and they said no. So we will be preparing a PIP for that, which is a performance improvement plan. Again, this data is from 2022, so we'll also look at, I think potentially we are over that right now, but we have to respond to this measure based on the information that we received.
And Jamie, I think this is always an interesting one. This has kind of been one that's off and on for us in understanding the complexities of that. And our response time was kind of, we were looking for some direction from the state at one point, because
Right.
what is 24 hours? Is 24 business hours? Is it 24 hours on a clock? Because, I mean, you can get people that call on a Friday at
Right.
4:29, and
So there has been some, yes, we've had a lot of back and forth with the state over what's meant. I think the state has been confused about the issue as well. I think we finally got some clarification about a year ago. But what's interesting is the next measure, which is percent of expedited SNAP applications processed within 1 business day. So you'll see this one has the other one, I think, if it's not expedited, I'm not sure if we have 60 days or how many days, and that's what we missed. We made the 1 business day, so we made the higher threshold, and that was, we were at 63.6%, and the state's performance is at 38%. So expedited, we're doing great. I think we're also probably doing well on the timeliness. The other thing I wanted to pull out too, and I have it here somewhere, is that our number of SNAP cases grew from like 750 to like over 1,000 during that period too. So same number of workers, a lot more cases. So, and I think now we might see that number. I'm not sure. I don't anticipate that number going up in the future.
so you're saying we went from 750 to 1,000 in
Right.
just the last quarter?
No, during the period of this, when the data was drawn in 2022.
2022, okay.
Yeah. So I always want to make sure that I'm sharing those DHS performance measurements with you. So that was our most recent one. Just also an awareness issue, we are getting our allocations from DHS for next year's reimbursement rates for our TCM or our targeted case management rates. Unfortunately, many of those reimbursement rates are going down, not only for Wright County, but for other counties. This will impact our budget, as well as other counties in the state's budget. And just for an example, our 2023 rate for VADD and adult mental health was $569, and that's going down to $406. On the other hand, on the good side of the equation, our children's mental health TCM rate is currently at 809, is going up to 954. So it's all a numbers game. How many cases do we have? How many staff we have dedicated? So we are crunching those numbers for our 2024 budget now, because it's kind of they're just coming into us as we speak.
And it's interesting, is this a shift of funds within DHS? Or, because the funding at the state level, from my understanding, was linear from a DHS perspective, so they must be shifting money within the internal organization?
Yeah, I really can't make heads or tails of it. I looked up the reimbursement rates for all the counties, and some counties are getting, $1,400, $1,500 for a single hit. I think, I'm not really sure. I think we're all kind of, I don't want to say clueless because that doesn't sound good, but we're all a little bit not clear on what DHS, I think, has been not real forthcoming on what their calculations are and how they make the distribution formulas for a lot of these.
And this was the one group that we were part of a consortium for a while, and then we decided to go standalone on terms of that. No, or am I mistaken, or is that a different?
Yeah, no, we did that in our financial services. We weren't able to
Okay.
do that in our social services.
Okay.
And we did see an uptick in our financial services when we did that. I did want to give you an unwinding report, and just to be clear, we all understand that unwinding are these medical assistance cases that are currently, over the course of the next several months or almost a year, will be reviewed. So I asked Kim Johnson, our financial services manager, for an update. June, Wright County had 539 healthcare cases to be renewed. 78 of those cases auto-renewed. So this is that auto-renewal is that fast path, so the cases that would need very little to no interaction on the worker's part. So unfortunately, out of 539, only 78 went through that fast path. So we did have to actually do the more stringent renewal process for the rest of those 400 or however many of their cases those are. So that was a significant number that are not auto-renewing, which equals more staff time. So in July, we're anticipating we have 695 cases to review that need to be renewed. And in August, we're expected to have 759 cases to be renewed. So staff are struggling as DHS moves forward with big changes on very short notice. Staff are using workarounds to process cases for clients. Clients that are entering this process most of them are new, or they have not had to do this for 3 years. So there's an escalated number of calls coming in regarding these renewals. In addition, DHS, and I think it was well meant, has implemented some text messages to send to customers to kind of give them more information. However, I think our clients, because they've never interacted with type of messaging from the state, is leery of it or wary that it might be a scam. So they're calling to make sure that these text messages are on the level. So that's also increasing some of the calls that are coming in. Let's see. We currently have one lead eligibility specialist, an LES, who's training or retraining all staff on healthcare renewals, because there are only 4 staff members who are experienced doing Maxis Healthcare. That means they were here prior to the pandemic when we actually were doing this work, because it was kind of in a hiatus status for this last number of years. And we have 3 open ES positions and 2 open LES positions. So Kim would like to say that she has a great team doing great work. They're doing their very best job they can and will come out the other side of this with experience that exceeds their years of service when this is all over. Until then, any support that they can get is appreciated. It's been a bumpy start. We were kind of had our fingers crossed that many more of those cases would go through the auto renewal process, and that just isn't what's happening. So that's kind of where we're at with that. Finally, we are saying goodbye to 2, if you recall, about a year ago, we came forward with requesting that we bring AmeriCorps staff on board, that they would be working with our public health department. One of them was working in the environmental water area. The other one was working in the ship area. So we're saying goodbye to our 2 staff. It was Rajana Patak and Sophie Sadsloff. They're leaving us on Friday. Shelley Layer, a public health nurse, is also retiring on Friday. So be a bit quieter in public health after Friday. So those are my reports on that. Thank you. Do you have any questions?
I do have a question, Mr. Chair. Jamie, is there something from our level that we can request from DHS to maybe explain some of these changes, and so that we can maybe forecast them in the future, and so that we're not seeing this bounce around fact?
Are you talking about the TCM rates, or are you talking about the unwinding piece?
More like where the funding, because it seems like it's all changing. So
I would say with Christine Partlow, and she still shares a lot of information. She was very close to DHS and was on the work, the work group that was working with it. So I think we had as much insight as any county, and probably more than most. I think it's just really a very opaque process. I have both Jill and Michelle here. I don't know if either of you have any more information other than we literally sit in our desk chairs and wait for that allocation report to come out to see what it is, and it's just a hit and miss kind of thing. So we're hoping the state is going through what is it called? Re-looking at the process. But I think we're still a few years out from that.
That's been a big thing for AMC, to try and simplify the process and to make a little bit more of a transparency to it, and a little bit more consistency with it. But over the last decade, it's been the same up, down, move around kind of game.
And honestly, some of the, and I don't want to get my waiver and my TCM things confused, but with we were kind of hoping with the increased salaries and the rent that would impact our reimbursement rate, because we would have more overhead to cover, so our reimbursement rate would be impacted by that, but it doesn't look like that's actually what's happened.
Does the state tell us what triggers a non-auto renewal versus an auto renewal? Because I would guess it'd be change of employment might be a triggering factor, right, or a substantial income.
No, I think it's how but I think it's how the client interacts with, online with their information. If the client comes in and puts the information in, I think we are good, but I think it's when they either leave out information, potentially, maybe provide a employer without dates or something like that around it, then the auto renewal doesn't go through. We were hoping that, just given we've advanced so much for people using, online types of interactions to complete business, that we would just have a higher rate.
Because is the state still requiring a certain amount or certain types of applicants to have to still do paper applicants? Because I think there's certain ones that they used to require certain types of ones have to do paper applications. They cannot do online applications. If
they are, it's very few, and it's some of those very, those cases with a lot of nuances to it, around long-term care or something like that. I don't think they're required to do paper. And again, I don't have Kim here, but I think it's not very often that they need to do the paper applications anymore, which has been great. I mean, if we were facing this same challenge with paper applications, it would be, a bigger mess than what it is. And Commissioner Shane, back to your earlier question, if I can direct it toward the unwinding process. One thing when Kim was asking for support, if you recall, either a month or 2 months ago, I came in and told you about the $647,000 that we did get from the state to help us with the unwinding process. So we will be going to a personnel committee of the whole and asked for 2 years to use some of that money for an OT1 that can kind of direct with the phone calls and take a lot of that off of the eligibility specialist plates so we can get some of that work done. So the request at that point that we would like you to consider is a 2-year OT1 position to help with the unwinding process.
So, just to give these the perspective, so you're talking about like in July, you have 695 cases for
Right.
these, and of them, probably 600 of them will not be auto renewals. And so you're taking that and you're dividing it out by a staff of about 5 right now currently.
Right now, yep, until we get more
to do
training.
that. And what that workload largely consists of is they're chasing a lot of people around to get, you know what, hey, I need this document or a paycheck stub, proof of employment. We need your tax return because when they submitted their application, they left a lot of it opaque or missing pieces to it. So they're playing a lot of cat and mouse phone calls, emails, and trying to collect this information. A lot of
And-
times it's carrying over
yeah.
to the next month because they're sending them, hey, you're not going to get renewed if you don't get us this information. So you're still carrying ones from the previous month.
So this, in that way, the OT1 could help because they could scan in documents that are verifying some of this information and get it into that case file for the eligibility specialist. On top of it, which is a big surprise to all of us and not a way we used to operate whatsoever, is now the state, in conjunction with the federal government, has said that if someone ignores our repeated requests for, do you want to renew your application? If they ignore it, we can't just call that a non-cooperating client and close them, thinking maybe they don't want to renew. Now we have to pursue that to make sure that they really don't want to renew, even when they're not responding. And that's not a way we used to ever operate in this world. We would do it in other areas, but not in something as transactional as medical assistance applications. They want to make sure that nobody's getting kicked off MA that shouldn't be or doesn't want to be. So it has heightened the parameters around how far we have to go to pursue people to get information.
It's my hat's off to them because that's a pretty heavy caseload, considering the fact that you're, like you said, you always have a carry forward from previous months, and
We'll
still
be
trying
talking
to,
about it all year.
Yep.
So,
thank you.
Thank you. Then we actually have our OSAC group is here, so I would ask Ellie and Becky to come up. Thank you.
Good morning, Commissioners.
Good morning.
Good morning.
Good morning.
Okay, Becky Graham, Public Health Nurse, and Ellie is here as well. We are here to give you an update on the opioid epidemic response request for proposals that we received from the public. So I'll let Ellie start with the process.
So just as a quick overview, the deadline for applications was May 31st, and we received 13 proposals in total. All of those proposals were sent, or the names of all of those proposals were sent to our potential review team members, who then disclosed any conflicts of interest. Those conflicts were reviewed by our legal team, and we were able to form our review teams. All of the RFPs were assigned to 4 to 5 reviewers, who then scored them and then came together for a group review. All of the proposals that scored above a 65 after the group review, 65 out of 80, were then sent through finance and finally to our settlement advisory council to make this formal recommendation that we are bringing to you today.
So in your board packet, you received this PowerPoint. However, the names of the entities were not disclosed at that time because we didn't want them in the board packet public before we actually came to the board. So you did know about 2 agencies or 2 entities that were county entities. So Wright County Health and Human Services is being recommended for $100,000 for their co-responder program. There's a short summary there of what that program entails. So I won't read all of them. Minnesota Prevention and Recovery Alliance is receiving $99,608.84. We're keeping it to the penny. They are known for Know the Truth, which is a youth prevention campaign, anti-stigma and education. And then again, a summary of what they will be doing involving a couple of Wright County schools, court services, and Right Choice. And then they will also do some support work with the MEDA Coalition. The Wright County Sheriff's Office is also being recommended for $100,000 for the co-responder program, and that is a partnership with Health and Human Services to extend their pilot that they're working on right now. The Buffalo Police Department, $32,200 to purchase a narcotics analyzer. Recovery Unleashed is a local recovery agency. They are being recommended for $30,592 for some housing supports. Oh, office creation should be crossed out. That part was removed. And peer recovery specialists. Central Minnesota Jobs and Training, they are being awarded $97,000 for increased peer recovery specialists. And the Buffalo Hanover Montrose School District, Parkside Elementary, $40,600 for some social emotional learning curriculums and trauma-informed practices. That is what we have to recommend for you today.
Thank you for the overview of the items. I think they're well vetted. Commissioner Dietrich, do you have any comments or sitting on that group?
No, it was very good discussion, and I'm really glad we got the number of applicants we did and had to sort through them. I think this is a good start, so great job.
Thank you.
Thank you. So with that, I'll entertain a motion for the approve the Opioid Settlement Advisory Council's recommendations for the first round of requests for proposals for funding.
I'll make that motion.
Motion by Commissioner Dietrich.
Second.
Second by Commissioner Shane. Any further discussion? Hearing none. All in favor, say aye.
Aye.
Opposed, same sign. Motion passes unanimously. Thank you.
Thank you.
Thank you, commissioners.
All right. Now moving on to the items for consideration. We'll come back there. Here is the committee recommendations, the approval of the recommendations from the June 21st Personnel Committee. 1 second. My computer went to sleep. So we have the first recommendation was to approve the request for adding a case aid position with the reimbursement of the $46,349 coming from the Buffalo School District for the Right Track program. The recommendation, they approved the request of hiring the turn coordinator position with the 48 salary. The second item would be the request to reclassify an OT2 to a case aid in Health and Human Services. Then the other one would be the recommendation to continue to reach a research on a reclassification request to bring forward at a later date for the IT department. So most of these are largely, the funding on them is pretty linear. The budgetary impact is minimal. But discussions. When I say minimal, I think in Administrator Kelly, I think when we reviewed it, the collectively all of them were, the impact was, I think one of them was to the positive and one was maybe to the negative, and it washed pretty close. There might be a differential of maybe a couple $1,000s.
It was pretty close.
It was pretty close to that, so yes.
Mr. Chair, thank you for clarifying that. I'll go ahead and make that motion.
Second.
Motion by Commissioner Shane, second by Commissioner Dietrich. Any further discussion? Hearing none. All in favor, say aye.
Aye.
Opposed, same sign. Motion passes unanimously. All right. Now moving on to advisory committee updates. Mr. Kelly, you have anything to bring to the board at this time?
Yes, I get to start. Since Commissioner Ketchmark is not available today, I do want to steal his thunder and mention the Wright County Fair is coming up on the 19th through the 23rd. Be sure to attend that. Do also want to take just a moment. We talked a bit about various things that county staff are doing that are great works, and oftentimes there's hard days that are on us, but I had the opportunity yesterday, AMC had reached out to administrators to tour different facilities in the state and had selected us to tour our jail. So had the opportunity to walk 6 interns from AMC and a couple of their staff through our jail yesterday. And again, was continually impressed by the work of the staff there, the professionalism, the innovation of some of the programs, and just the compassion that they show. So I just wanted to say thank you to all our correction staff. Also thank you to Captain O'Malley and Sergeant Flesher for helping out on the tour, and Alan for helping coordinate. So it was just a nice opportunity to see our operations. So wanted to recognize their great work. That's all I have, sir.
Thank you, Administrator Kelly. Commissioner Shane?
I had the opportunity to go to Rockford Township and the Hanover City and just kind of get an update from them and what's happening in their area. The biggest thing that I'm kind of looking forward to is in September, they're having a land design person come in and talk to them about their downtown area and the recreation of 19 and how we expand on that county road. So that's going to be interesting. I'm going to add a little bit to Lee with the county fair that I do plan on attending and meeting with the board there and touring around and meeting people. So I'm kind of excited about that. We have the Wright County Township Officers Association meeting coming this week. I'm planning on attending that as well.
Thank you. That is
Thursday.
Thursday, yes. And so Central Mississippi Regional Planning Partnership met maybe it's a couple weeks ago. We're still moving forward with the transition from a JPA to a nonprofit. We're now entering into a larger discussion of creating bylaws as we feel that this organization is best suited as a nonprofit, as it works more as a solicitation of support for funding for the projects as they move forward, and the 2 counties will move forward as more the JPA through the local government unit in applying for actual projects itself. Tomorrow night we have a Ditch 33 informational meeting on a lot of projects that are coming up forward on that ditch. I look forward to that conversation. Myself and Commissioner Shane have been having a lot of discussions with the Wright County EDP and some different ways on how we can leverage economic development in the county, whether it's through the county or through the EDP, as we get ready for the budgetary sessions.
Just a couple updates. Central Minnesota EMS met and they did get funded by the state through the next couple of years, so that is good. So they can continue to offer equipment and training for our emergency responders for our central district. Also attended the Transportation Alliance, and just between the state and federal funding that's available for infrastructure with roads and bridges, keep that in mind as you develop your nonprofit for the river crossing. They do have planning funds as well as infrastructure funds available, and it's just starting to roll out this summer, some of the procedures on how to apply. So that's all.
So, and before closing, I want to applaud the staff's great work on the nuclear exercise. Took place from, I think, everybody from public health, emergency management, administration, all the way across to the sheriff's department. A lot of different aspects of the county participated in it. It was a successful exercise. They did a great job, so I want to give my hats off to them on that. Is there any other business that we need to attend to on today's board?
No, sir.
If not, we will adjourn today's board meeting at 9:39.